Hi, everybody. Today we're going to be focusing on the appendicular skeleton. So let's go ahead and get started. So one of the first bones that we're going to discuss is the clavicle. Clavicle has two ends. One is connected to the scapula and the other one connected to the sternum. So the end that is connected to your sternum is identified as your sternal end, and the other end, which is connected to the scapula, is connected to a structure called acromion process, and therefore is called the acromial end. The second structure that we have, sorry, I'm just going to see if I can do laser pointer. The second structure that we have, or second bone we have, is your scapula. So scapula has two views, and this is the posterior view of this scapula, where you have this really pronounced bone sticking out of the back, called the spine. And the end of the spine is a bone called the acromion. So if you guys recall, we just talked about the acromial process on the clavicle. This is where that process basically connects to. We also have three borders for the scapula. We have the lateral border, basically the border that's pointing outside. The medial border, which is kind of, if you want to imagine it, closer to the vertebral column. And then you have a border on the top, which is called the superior border. Now, if you take a look at your spine, a spine literally breaks the bone to two pieces, the bottom piece and the top piece. So the top portion, again, this is flat piece of bone, or shallow and broad surface. So the top part is called supraspinous fossa. Supra as in superior, spinous as in above the spine, supraspinous above the spine, and again, fossa is the surface. This larger surface that sits below the spine is referred to as the infraspinous fossa. If you're looking at the anterior view of the scapula, you have this, again, one large flat surface called the subscapular fossa. On the posterior aspect, you can see the acromion, and this portion would have been your spine. You have this little pronounced notch right here called the scapular notch. And then right here, and I show you a different view as well, which is this structure right here, is where the head of your humerus joins to basically forms your shoulder girdle. So this is called the glenoid fossa. So this structure right here is that kind of the oval dent that you see right here for the head of the humerus, called the glenoid fossa. Now, the anterior structure or process that is viewed here, called the coracoid process. Again, don't mistake that with the coronoid process that you identified on your mandible. Again, most common mistake I see, coracoid versus the coronoid process. So be careful with your vocabulary. Now, moving down from your shoulder down to the bone of your arm, we have the bone as a whole called the humerus. So humerus has this kind of, again, the structure that fits into the glenoid fossa. That's the head of the humerus. So you can see that kind of roundness that basically fit into. So this is the same area from a different view. You also have two neck. The anatomical neck, which is pretty small, right below the head. So here is the head, that is your anatomical neck. And going below that, the kind of the area right below that is called the surgical neck. Sorry, you don't see the S, but there's an S right there. If I'm looking from the superior view, so basically looking at the bone from the top, again, here is my head. And I also see two processes or structures sticking out on the side. One big one, which is right here, and one is small one. On this view, the small one right here is this one right here. And this big one is the more pronounced one right here. So the smaller one is called the lesser tubercle versus the greater tubercle. And you have this kind of a groove right at the center, which is the groove right here, called the intertubercular groove. As in groove, between the two tubercle, right? Inter means between or in between. Going down the humerus, you have this surface right here that's very, has this pronounced structures, little bumps on the surface of the bone. This is where your deltoid muscle, or that big triangular muscle over your shoulder, connects to your humerus, and that is called the deltoidtuberosity. Deltoidtuberosity. Going toward the distal end of the humerus, so the part that is getting closer to your forearm, basically, or your elbow joint. What you have right here is a couple of structures. I'm just gonna kind of show you here. You have this kind of a half bow structure. It looks like a, I guess, not properly tied bow. That's at least what it looks like to me. This structure is called the trochlea. So this little structure is called the trochlea. And then you should see a kind of a circular structure right here. That's called the, oh wow, my brain just froze, I'm sorry. Capitulum. So we have trochlea and capitulum. Little indentation right on top of the trochlea called the coronoid fossa. So this little indentation right here. And a little indentation right here called the radial fossa. So when you're looking at this bone, humerus is going to basically form articulation between, you will form articulation with humerus as well as the ulna and radius. Those are basically the three bones that come together to form your elbow joint. So we'll come back to this in just a second. So again, you have this indentation right here called the coronoid fossa, and there is an extension of the bone on the ulna that's gonna fit into this cavity called the coronoid process. Now, on either side of this bone, you have these little protrusions or processes. These are, again, points of attachment for muscles. They are called the medial conda, which is more pronounced. You can see this bigger compared to the lateral epicondyle, so which is a smaller. Do keep in mind, guys, that the head of your humerus, which is that kind of bulbous area that forms your or connects to your shoulder, that's always pointing toward the medial aspect. So if I was showing you the end of this bone, and let me just kind of quickly do a quick drawing for you guys, 1 second. If I was doing, I'm just gonna use my pen. So if I was kind of showing the other end of the bone, and kind of imagine this is the end of the bone, my head would be pointing this way. So this is basically the head, and this is basically would be my, it's a really bad drawing, where my scapula would be located. So keeping that in mind, if looking at the head, and I know what direction the head is pointing, head is always pointing medially. So this would become my medial epicondyle, and the smaller one on this side, on the opposite side of the head, would be my lateral epicondyle. The next thing we have is if we turn the bone around, you can see this really pronounced indentation in my bone. That's called the Olecranon fossa. And again, on the ulna, you will have an extension that fits into this Olecranon fossa, and it's called the Olecranon process. So fossa is a surface, and then if you hear the word process, is an extension of the bone, which basically allow these two structures to fit into each other. Kind of orienting yourself, and if you want to take a practice on this little protrusion right here would be your medial epicondyle. This protrusion on the side would be your lateral epicondyle. This, your half bow tie that I was telling you about, this structure, that's your trochlea. And right here would be where the little circle is, that's your capitulum, if you want to kind of orient yourself. Now, if you're looking at your ulna, here is the ends of your ulna. So you have one little bump here, one more pronounced one right here, and then kind of an indentation or a notch right at the center. So kind of let's orient this. This big process right here, this is called the Olecranon process. So this is my Olecranon process, which is going to fit into what? Fit into my Olecranon fossa. So Olecranon process of my ulna is gonna fit into my Olecranon fossa of my humerus. This little one right here is the coronoid process, and it's going to fit into the coronoid fossa. This dip that you see right here, that dip at the center, is called the trochlear notch, which is basically going to be run right on the surface of my trochlea, right here. So it runs, oh wow, I'm so sorry guys, my pen has a mind of its own. So it runs on the surface of the trochlea. So if you are fitting them together, here is basically my ulna, and sorry, my drawing is not the best drawing, but hopefully it will convey the point. And here is my humerus, okay? This is my trochlea surface, okay? That fits into the trochlear notch. Right here, this little bump right here is my coronoid fossa on the humerus that is fit into the coronoid process of my ulna. This bigger one, it's called the Olecranon process that is fitting into this larger cavity called the Olecranon fossa. Together, this is basically majority of your elbow joints. So that little bump, you know, when you belt your elbow and you see that little, you know, bony part protruding, that forms basically your elbow that, you know, when you hit it, it hurts like hell. That's basically the Olecranon process that has fit into the Olecranon fossa. Hopefully that makes more sense. On the distal end of the ulna, basically this is where you get close to your wrist. You have this little bony piece that is sticking out called the styloid process. And on the opposite side of this, you have the head of your ulna. Radius is another bone. So if you're looking at the radius from the superior view, so from this view up here, the head of the radius is circular. And what does a circle has? It has a radius. So hence the name radius. That's how I remember it. I don't know if that's a reason for it. But again, look for that circular head. If you do see it, that's your radius, and it's also identified as the head of the radius. Area immediately underneath that, that's the neck of your radius. You have a little bump for muscle attachment called radial tuberosity. And on this end, which is what you see here, you have this little extension again. If you look at it from the superior view, you have the little sharp end. That's the styloid process. So you have a styloid process on both radius and ulna. And you have this ulnar notch, this little notch that I've drawn here. If I put the ulna right here, ulna would fit into right here, hence the word ulnar notch. So they sit, the bones sitting right next to each other. So if here is my ulna, okay, here's my ulna. If you imagine it, let's say this is my styloid process on this end. My radius reading sitting here, it has this little bump that allows the ulna to sit into it, and that's your ulnar notch right here. This is right here is your ulnar notch right here. And again, on this side, you will have your styloid process, which is depicted right here. Now, the bones of your carpal is total of 8 bones that are form your carpals. Typically, if you're taking a lower biology class, or anatomy class, they just tell you that these 8 bones collectively are called carpals. However, for this class, you do need to be able to identify all 8 bones individually. So the way we identify them is first we identify the metacarpals, which are the bones of the palm of your hand. And we start from your bone from the thumb. So that's metacarpal number 1, followed by 2, 3, 4, and 5. So that's your pinky on this side, and that's your thumb right here, okay? So if you're looking at this, your radius bone would be sitting right here, and your ulna would be sitting on this side, because radius always sits on the side of the thumb, and then ulna sits on the side of your pinky. If this is the orientation anatomical position. So the bone that we have are the scaphoid, lunate, triquetrum, pisiform. So that's the first 4 that are medial. And then followed by trapezium, number 5, trapezoid, capitate. I feel like I can number, guys, I'm sorry. 6, capitate, and then the last one is just hamate. Homunculus of hamate is just a little bone part of it, but the bone itself is called the hamate. So this is what we shorthand this. Some lovers try positions that they cannot handle, right? That's the way that if you want to use it. So again, scaphoid, lunate, triquetrum, pisiform, the top 4, then go on the same side again as the thumb, and then trapezium, trapezoid, capitate, and hamate. Please focus on these guys. There's typically at least 2 or 3 questions off of the carpal bones. Now the bones of your palm of the hand are called metacarpals, and then your fingers. So the metacarpals, as I mentioned, for your thumb is number 1, followed by 2, 3, 4, and 5, making your pinky number 5 metacarpal or 5th metacarpal. So if I'm asking you for a metacarpal, don't just simply say metacarpal, you do also need to identify them by number. The bones of your fingers as a whole. So if I'm talking about these bones, basically, and again, I'm kind of circle these, all of these bones together. These are as a collection called phalanges. Phalanges, oops. But because we're a larger class and we're more advanced, we name each of these bones separately. So they are named based on their location. First thing that you want to establish, are they proximal, middle, or distal? So these are the closest bones to the point of attachment, let it be metacarpals or your wrist. So these are proximal. I'm just going to label all of them. The second bone is middle. And then the tip of your fingers are going to be distal. Please notice that the thumb only has 2 bones, so there is no middle bone. It's either proximal or distal. I always tell my students, if you have 2 kids, you don't have a middle kid. You have first and you have a last. So the way that we name them is whatever, proximal, distal, or middle. The second word is gonna be phalanx, which basically means bones of your finger. And then the next thing you wanna identify is the number and then the word digit. So again, this is your number 1 finger, 2, finger 3, 4, and 5. So if you follow this, and I said, name this bone, okay? So we said, okay, so it's proximal, go back to your list, it's proximal phalanx, P, proximal phalanx, and then number 3, 3 digit. If I ask you to name this one, it would be distal phalanx, 5th digit, right? Number 5, because that's your pinky. If you learn this for your fingers, you can also use literally the same pattern for your toes. There is no difference in that sense. Now switching gears to your lower limb, we're gonna start with the bones of your pelvis, or your pelvic bone, I guess I should say. So pelvic bone is actually a combination of 3 fused bone called os coxa. We have the top bone, which is called the ilium. This is the largest of the three with the largest fossa. We have the bone that basically come together and connect the two pelvic bone together, called the pubis or pubic bone. And then this bone that sits on the back, this one is kind of rough. It has a very wide surface, very rough surface, called the ischium. So three bones. So in this picture, again, this bone right here and right here, those are your pubic bones. See, they come together to basically connect your pelvic. This bone right here, this is a roughened surface. These are your ischium. And then on the top, you have your ilium bone. Lots of names. Okay, so when we're talking about ilium, first of all, the front and back is not by flipping the bone to the front and back, is how it is oriented in the pelvic region. So if you're looking at the pelvic picture I show you here, the posterior aspect of the pelvic, which is this region right here, this area right here, it's kind of roughened surface. This is the area that actually connects to your sacrum, which is this bone right here. That's your sacrum. And if you guys don't remember your sacrum, go back to your axial skeleton. So this surface right here from each of your ilium connects to your sacrum, one on this side, one on this side. So this is literally sitting on the butt area, right? On the back side, making this your posterior and this side your anterior. So the bone is not sitting straight, it's sitting in an angle. So think about like literally turn your bone around with this part being in the front and this side being in the back. Now, on this bone, on your ilium, you have 4 little protrusions or processes. So I'm kind of showing you these 4 processes. Now the order is as is if I'm starting with the simplest one, which is right here. Anterior, superior, and is always stands for iliac spine. So iliac spine, iliac spine, iliac spine, iliac spine. So only thing that you're changing is the part as is. So anterior, this is my anterior view, this is my posterior view, right? So anterior, right? Inferior, because it's below, anterior, inferior iliac spine. This one would be posterior, right? It's in the back, superior iliac spine, and then posterior, as in back, inferior, because it's below iliac spine. This large surface you have right here is called the iliac fossa. The crest that you see on the top of the bone called the iliac crest. You have 2 kind of indentation, one big one is small one. This is called the greater sciatic notch, and this one, as you can see on the next one, it's called the lesser sciatic notch. So greater and lesser sciatic notch. It's on the side of the ischium. So here again, greater sciatic notch, lesser sciatic notch, and the area where it separates them is called the ischial spine. This surface, which was basically marking the ilium as posterior, is the surface that comes into contact and attached to or form articulation with the sacrum, called the articular surface. Sorry, not articular, auricular surface, I apologize. Auricular surface. The area where the head of the femur fits in, which is this little cavity, is called the acetibula. So if anybody has a hip replacement surgery, basically this is the area where the femur fits into the acetibulum. That's where the surgery takes place. And then you actually have a wide hole in the ischium pubic region called the obturator foramen. Here's a different view. Again, imagine your femur would be sitting right here. That's your femur right here, forming your pelvic joint. Here again, the ischial spine, the lesser sciatic notch, the greater sciatic notch on the top, And remember I said ischium has this kind of bump surface, like this whole surface right here. The bone itself is ischium, but if I'm talking about the surface on the bone, that's called the ischial tuberosity. On the front view, again, if I'm looking at this bone right here is my ischium. And this bone right here is my pubic bone. Pubic bone, here's another pubic bone that they come together basically. The area right on the top is superior, the area right below is inferior ramus. The arch that is created by putting the two pubic bone together is called the pubic arch right here. The cartilage that holds this together, this structure right here, this structure right here, is called the pubic symphysis. And the surfaces where the cartilage comes together is called the symphysial surface. If you want to kind of imagine when we're comparing a male versus a female pelvic, this is your pubic arch, right? So in women, the pubic arch is wide because again, you want to create what we call a wide pelvic brim, versus this for male, it's the pubic arch is narrower and the brim is more circular than it is oval. Again, kind of think about it in women, you want to give childbirth, so you basically want to have a pelvic brim that is wide or a broader pubic arch, so the baby's shoulder can pass through the birth canal. I always make this joke that, you know, when you look at like 16th, 17th century clothing, you know, women used to wear these really like wide dresses that they, you know, they would wear those like metal cages underneath their dresses that kind of give them that wide pelvic to basically advertise for themselves that they are good women, they're good childbearers. So basically, the wider the pelvic rim, the higher chance of basically giving birth to a healthy child. I don't know how true that is nowadays, at least. Since we don't actually carry the bone in our hands, I don't, and I cannot expect you guys to be a kinesthetic learner and be able to distinguish right and left. So I am going to skip this slide from you guys. Now moving to the femur, as I showed you, the femur head is going to fit into a space called acetibula. So here is the head of our femur. The area underneath that, that's the neck. Like your humerus, you have two little bones or bumps, one is small, one big. They're called the greater and the lesser trochanters. And then there is a little indentation on the head called the fovea. So here's the femur as a whole again. Here's your head, here's your neck, here is your lesser trochanter, and here is your greater trochanter. On the other side, on the femur, this is basically the area that forms your knee joint. So these are called medial and lateral condyle. Easy way for you to identify medial versus lateral. Again, remember that the head is always pointing medially. So that makes your medial condyle, and this one your lateral condyle. The space between that would be your intercondylar notch. So this little area right here is your intercondylar notch, I apologize. And then you also have the little bump on top of that, and on the same side, on the medial side, called the medial epicondyle. So right here is the medial epicondyle. Here is your medial condyle, and here's your lateral condyle. Again, no need for you guys to know right and left. If you're looking at the bones that form the lower part of your leg, you have tibia and fibula. Tibia is the thicker bone that is located medially, and fibula, which is the thinner of the two, is located laterally. So typically, if you see somebody fractures their bone on their lower leg, lower portion of their leg, they typically fracture the fibula, which is the skinnier of the two. I call them susceptible to fracture. Fibula is susceptible to fracture, F for F. And then this one, I'm gonna laugh. I said, you know, when you hit your leg on a table and you feel that pain, what you're actually typically hitting is your tibial tuberosity, that little bump right here. So T for table, tibia, you're hitting it on the table. Anyway, so this surface you see right here basically fit into these surfaces you see right here, just your medial and lateral condyles, and that basically forms your knee joints. So right here basically would be your medial and lateral condyles of your femur. So again, on this side, you have your medial condyle. One way for you guys to identify the medial condyle on the tibia is now go to the other side, go to the distal end. Do you see this structure, this kind of process, the very pronounced process? That's called the medial malleolus. So if you can see this, you can say this is the medial side, since this is always on the medial aspect of the tibia. So medial condyle, lateral condyle, and then that little bump on the front, when you hit on the table all the time, that's your tibial tuberosity. If I'm looking at the top view of the tibia, so I'm looking at the superior view, this would be my medial, this would be my lateral condyle, and there's this little two bumps right at the surface. It looks like ET right now. I'm sorry, I just noticed this. You guys know ET, you were like, wow, it looks like ET. Kind of like misshapen ET, but still. Anyway, sorry. So this is called intercondylar eminence, these little bumps at the center. On the other end, again, that pronounced structure you see is medial malleolus, which is right here. And then this little dip basically is where the fibula is gonna fit into. Therefore, it's called the fibular notch. Kind of like what we talked about radio, and the radius had the ulnar notch on it, same concept here. Tibia will have a fibular notch, basically where they fit into each other. Just to kind of clarify, the medial malleolus, and then I'll talk about what we call lateral malleolus on the fibula. These are the two little bumps you see on the side of your ankles, which basically gives you your little bumps. And if you ever twist your ankle, you can see a lot of swelling in this region because there's a lot of ligaments and tendons that are connecting the tibia and fibula to the bones of your tarsal. Again, you can skip this slide. Going to the fibula, you only need two structures. The one that is more circular versus the one that is more extended. The circular one is the head of the fibula, which is sitting connected to the femur. And then this side, which is more elongated, that's your lateral malleolus, which is again, that little bump you see on the side of the your ankle. A lot of swelling if it's twisted. For patella, all you need to know is that patella is basically your kneecap. It has a base and then it has an apex, so base and apex. If you look at it from the posterior view, you have a surface that is smaller versus a surface that is larger. The larger surface is the lateral articular facet, which basically articulates with your knee joint. And then the smaller of the two is the medial articular facet. The bones of your tarsal, there are a total of 7 bones. Again, the larger of the bone is the calcaneus, as this is basically where your the heel of your foot is formed. Lateral to that, you have your talus. Then you go in front of that navicular, and then cuboid in front of the calcaneus. And then you have 3 cuneiform bones. Lateral cuneiform, which is closer to the 5th metatarsal. Then you have your intermediate cuneiform and then medial cuneiform, which is basically where your big toe header is. So one more time, I don't know if I said that right, so I'm just going to correct myself if I didn't say right. Sometimes when I talk a lot, things just get out of hand a little bit more. Okay, so on the lateral aspect, we have the fifth, which is the calcaneus, the heel of your foot. On the medial aspect, we have the talus, and then navicular, and then cuboid on the lateral aspect. And then you have medial, intermediate, and lateral cuneiform. You have 5 metatarsals, which is basically form the sole of your foot. First, second, third, fourth, and fifth. So that's your big toe, that's your pinky. And then moving on, the bones of your toes are the same as what we discussed for your fingers. So you have proximal, distal, proximal, middle, distal, proximal, middle, distal. I'm just going to write them so you guys can practice them. Proximal, middle, distal. Notice that your big toe again has only 2 bones, so you only have proximal and distal. Same pattern as we discussed. You write either proximal, middle, or distal. Second word is always going to be phalanx, followed by the number, and then digit. So here's your digit 1, 2, 3, 4, and 5. So if I ask you to identify this bone, it would be proximal phalanx, 3rd digit. If I ask you to identify this one, it would be distal phalanx, 2nd digit, etc. So that's it for our appendicular skeleton. Please pay close attention to the terminology, guys, and if you have any questions, let me know.